About us, the Dalziel Agency, locally owned right here in Northeast Ohio. We're here to assist you with the Medicare process, all at no cost to you. Our free service will help you pick and choose what carrier and plan works best for you. We're licensed with 15 different carriers in 9 different states, so we can help you pick the best plan that suits your needs, no matter where you are. Basic Medicare. What is Basic Medicare? Medicare Part A provides coverage for inpatient hospital stays. Also includes skilled nursing therapy and hospice care. Medicare Part B. That helps with doctor services, outpatient care, durable medical equipment, mental health, and others. You have to have Medicare Part A and B in order to participate in any other types of Medicare plans. You automatically get Medicare Part A when you turn 65 or become disabled under Social Security. Medicare Part B helps pay for doctor office services, outpatient care, durable medical equipment, mental health care. You have to have Medicare Part A and B in order to participate in any other types of programs, which you're going to discuss here in a minute. The normal cost is $164.90. That is for Northeast Ohio for the normal Medicare participant. Now, there are people that may make a lot more money on Social Security that have to pay a higher rate, and people that don't make as much money as the norm, who might get help from Medicaid for the cost of their Medicare Part B premium. Medicare supplements and gap plans. They're actually the same thing, but some carriers call them Medicare supplements, some of them call them gap plans. They're the same type of thing. What they're going to do is they're going to cover the 20% that Medicare does not cover. When you have Medicare Part A and Part B together, that covers 80% of the billed services through Medicare. The gap plan or the Medicare supplement plans will pick up the 80 or the 20% that's left over. Plans A through N, if you see on the right-hand side of the screen there, it shows you what levels those are covered and what types of plans. They also have premiums that are attached to those, so depending on how old you are, where you live in the country, will determine how much your Plan A through N will cost you. And they may also vary by different insurance companies. They're easy to use. You just go to the doctor, they submit your claim to the Medicare supplement plan, and it pays accordingly to the scale on the right. But there is costs that are a part of those services. Medicare Part D, prescription drugs. If you have a Medicare Part A and B plan, and you purchase a Medicare supplement plan that covers the 20% that Medicare Part A and B does not cover, you will also need to purchase a Medicare Part D plan, which is for your prescription drugs. This slide shows you how to understand your Medicare Part D plan and how it works. All those plans that you see will have different premiums and different plan designs, but the biggest thing that we want to hear about or talk about is what you'll be paying. After you meet your deductible, if you have a deductible on your plan, you will be paying copays for services. Most plans out there have a 5-tier prescription drug formulary list. Some have a 6-tier, which would be select tier drugs, which are 0. That's tier 6. If you have a prescription drug plan and it has a deductible, you must meet that deductible before having any copays apply for your services at the pharmacy. Most plans have formulary plans that are 6-tier formularies. Tier 1 will be formulary generic. That's the generic drug that's on their preferred list. Non-formulary generics are the generic drugs that are not on their preferred financial list, meaning that you'll pay more for those drugs than you will the ones that are on their formulary list. Formulary brand, those are the brand name drugs that are on their formulary list. Non-formulary brand are the brand names that are not on their financial list. Specialty medications, those are Tier 5. A lot of those are injectable medications. And Tier 6 medication, which is select care drugs, which are 0 premium coverages under most plans. You may also be able to get a 90-day supply for your prescriptions. It's a different cost for 90 days, but some plans will actually give you a cost incentive to get it through the mail through their programs. It might be a 2 times copay of what the 30-day supply would have been, or a 2.5 times copay. Although some carriers, though, it's a 3 time and it doesn't save you any money. Medicare Advantage plans, Part C. This is the third and final option that you can have when purchasing Medicare plans on the market. That would be a combination of a Medicare Part A plan, a Medicare Part B plan, a Medicare Part D plan, and a Medicare supplement plan. What they do is they put all those benefits together in a package and they call them Medicare Part C. Those are Medicare Advantage plans. What they do is that they cover what basic Medicare would cover for your hospital insurance, for your Medicare insurance Part B. They would offer a prescription drug plan, and they would also cover the 20% that a supplement might pick up. But they put them all together in one package. They also add other things like dental, vision, hearing benefits, food cards, flex cards, silver sneaker benefits. They add all those into the Medicare Advantage plan, the Medicare Part C plan. At that point, you can use that card to cover all those services, no matter where you go. On the bottom left-hand corner of this slide, you will see the enrollment percentage of Medicare Advantage plans across the country. It shows a percentage from the national average of 2017 by state, how many people are actually enrolled in Medicare Advantage plans. The national average was 33% of the population, and that number continues to grow. How we help. What we do to help you as a client of the Dalziel Insurance Agency is we actually do research for you. We do the needs assessment for each client that we have, and we provide the members with the best product that they can purchase for their needs. We check all your providers and your prescriptions to make sure that they're covered under the plan that you're selecting. We never want you to choose a plan where you think that your doctors are covered and they're not. We will not let that happen. We also enroll you in the plan if you choose to pick one through the insurance agency here. We'll do it online for you, with you in the room. We'll make sure that it's all taken care of and completed with the insurance company so there will be no worries on your behalf. Understanding marketing tactics. These are things that frustrate a lot of my Medicare participants that are either becoming eligible for Medicare or are currently enrolled in Medicare plans, and the marketing tactics that go on. I just want to let you know a couple of the things that they can do and what they can't do. Salespeople can contact you by mail only. They can mail things to your home. They can mail them multiple times. That is not hostile solicitation because you are not trapped by anybody. You can throw those pamphlets in the mail that you get in the garbage if you want on the way in. You don't have to even deal with any of that, so you're not trapped. What salespeople can't do, though, they can't call you on the phone unless you've given them a consent to contact form or you've given them written consent to contact you on the phone. It is illegal for them to make outgoing phone calls to your home. So any of those telemarketing calls that you're getting, if you didn't fill something out telling them that they could call you, they're illegally contacting you. They also can't come and knock on your front door and visit your home without permission because now they have you trapped at the front door. They're not allowed to do that. They're not allowed to stand at the pharmacy counter or in your doctor's office and trap you there when you're coming to get your prescriptions or going to see your own doctor for your own care. They are not allowed to do those things. With pharmacies, though, they can stand over by the photo booth. They have to give you a clear path so that you can make it to the pharmacy without having to come in contact with them. If you do want to go over and talk to them, it's your choice, but you're not trapped going to the pharmacy. Things that I would tell you to not do. Don't call the 1-800 number on the television. That's just getting you on the call list. Don't click on internet ads. Don't give anybody your phone number or your internet or your email address, or you can expect to be on a mailing list for someone. So if you're frustrated by all that, these are some things that you can do to avoid that. So, social media. The Dalziel Agency is now on social media. We have been for years, but we've taken a different approach on how that we handle this. YouTube videos. We actually put out YouTube videos to show you how to enroll. Talk to you about Medicare Part B and signing up with Social Security, over-the-counter cards. How do you use those? We have lots of informational videos that are out there for you to watch. Hopefully, if you have time and you have any questions, go through our YouTube site at the Dalziel Agency, and you can watch those videos. We are always asking for likes, so that always makes us feel better. We also, if you want to join us on Facebook, we have a Facebook page as well, and we list in articles and put out different types of marketing things just so you can see what's going on in the marketplace. We will never contact you directly, though, so don't worry about any of that. We also, let's say you're interested right now and you need to enroll, and you're watching this video, you can go to Plan Enroll through the bottom click on the bottom icon that's there that says Plan Enroll, and you can actually go out and check rates. You could check plan designs, you could check providers and all that if you don't want somebody contacting you. You can do that. We won't bother you. But if you do have help or need help, we will do that for you. We'll make sure that you understand everything that you're enrolling with. Okay, thank you for watching our video today. We appreciate your time. I know you have better things to do, but thank you for sharing and looking at our video. John Dalziel, Dalziel Agency, that's me, my number, my email address. So if you have any other questions, feel free to give me a call. Have a great day, everyone. Thank you.